Your cat could die within 24 hours from a problem that most owners mistake for spite or a tantrum. See your cat straining in the litter box? You have less than a day to save their life. Hey there! Today I'm going to tell you about FLUTD, a group of lower urinary tract diseases in cats that can turn into a deadly threat in literally one day. After this video, you'll know exactly which symptoms you can't ignore, how to recognize an emergency situation, and what to do to protect your pet. If cat health matters to you, subscribe so you don't miss new episodes. Let's get started. Most owners think FLUTD is some specific disease. They're looking for one pill that will cure everything. In reality, FLUTD is an umbrella term. Imagine an umbrella sheltering a whole complex of different problems. Cystitis, stones, infections, blockages. Each problem has its own cause and its own treatment. When a cat starts urinating blood or outside the litter box, it doesn't mean they have just cystitis. It could be anything from this list. Remember, the symptoms are similar, but the causes are different. So never treat your cat by guessing or based on internet advice. Only a veterinarian can figure out what's actually happening. Now let's figure out who's most at risk. Many people think, my cat is indoor, vaccinated, well-fed. That means they're safe. Veterinary statistics paint a clear portrait of the typical FLUTD patient. It's a neutered male cat, overweight, living indoors and getting little exercise. But you know what's the most insidious factor? Stress. It's stress, sudden or chronic, that becomes the trigger for the most mysterious form of these diseases. Moving, a new family member, renovation, even relocating the litter box, all of this can trigger the problem. Evaluate your cat's lifestyle. If they're neutered, sedentary, and recently experienced stress, you're in the risk group. But even if not, you can't relax. The disease can develop in any animal. Now, let's look under this umbrella and break down which diseases are hiding there. Owners hear the word cystitis and immediately demand antibiotics. The logic is simple. Inflammation means infection. Feline idiopathic cystitis is the most common problem in young and middle-aged cats. The name literally means inflammation of unknown cause. There are no bacteria present. Modern veterinary medicine believes this is a malfunction in the body's stress response system. The bladder becomes the target organ for the stress reaction. Antibiotics here are not only useless, they can harm by killing beneficial microflora. For idiopathic cystitis, the foundation of treatment isn't pills, but pain relief and environmental modification. The vet may prescribe opioid analgesics for pain relief, but the main thing is to remove stress sources and increase water intake. The next problem under the umbrella is stones, and they come in different types. Stones mean I need to acidify the urine. I'll buy special food and everything will be fine. Stones come in two main types, struvite and calcium oxalate, and these are fundamentally different enemies. Struvite can be dissolved with a special diet that changes urine pH. But calcium oxalate stones don't respond to diet. They can only be removed physically. Moreover, if you start acidifying the urine without a vet's prescription, trying to eliminate struvite, you might trigger the formation of calcium oxalate stones, which are even more dangerous. Never start a therapeutic diet on your own. First, you need a urinalysis and imaging diagnostics to understand what type of stones your cat has. Only after that will the vet select the right strategy. For struvite, diet. For oxalate, removal, either flushing out small stones through urohydropropulsion or endoscopy with laser lithotripsy or traditional surgery. But there's another threat that develops at lightning speed: urethral plugs. My cat is trying to use the litter box but can't. Probably constipation. I'll wait until tomorrow. Urethral plugs are dangerous clots of mucus and crystals that can completely block the urethra. Due to anatomical structure, a narrow and long urethra, this threat is especially serious for male cats, not females. Complete blockage leads to acute kidney failure, severe intoxication, and death within 24 to 48 hours. This isn't wait until morning. This is counting by hours. If your cat is unsuccessfully trying to urinate, the abdomen is tense, they're vomiting, they're lethargic. This is an emergency. Get to the clinic immediately. Standard treatment includes placement of a urethral catheter under anesthesia, restoration of urine flow, and correction of electrolyte imbalance, especially hyperkalemia, which is dangerous for the heart. What about infections? Let's break it down. My cat has blood in the urine. Definitely an infection. Give me antibiotics. Surprisingly, in young and healthy cats, bacterial urinary tract infections are rare. Risk increases significantly only in animals over 10 years old, or those already suffering from chronic conditions, kidney disease or diabetes. Antibiotics are prescribed strictly after confirming the diagnosis through urine culture. And ideally, the sample is obtained through cystocentesis, puncture of the bladder with a sterile needle under ultrasound guidance. This avoids sample contamination and false results. Don't give antibiotics just in case. It's useless and dangerous. Now let's talk about symptoms you can't miss. My cat urinated on the couch. I need to punish them so they don't do it again. Cats don't seek revenge. If an animal starts urinating outside the litter box, especially on soft surfaces, this is a cry for help. Here's the complete list of warning symptoms. Difficult, painful urination. The cat strains, makes plaintive sounds. Too frequent trips to the litter box, but urine comes out in tiny amounts. Pinkish tinge to the urine. That's blood. Attempts to urinate in inappropriate places. Obsessive licking of the genital area. Any of these signs is a reason to visit the vet. Don't wait. Don't hope it will go away on its own. Your daily observation of how your cat uses the litter box isn't just a household routine. It's your most reliable barometer of their health. So how does a vet make an accurate diagnosis? Let's break it down. The vet looked at my cat and said, "We need urinalysis and ultrasound. Why overpay? Let's just prescribe treatment." Remember, the symptoms of all FLUTD diseases are similar, but the causes are different. Without diagnostics, you'll be treating blindly. The vet starts with a physical exam and abdominal palpation to assess how full and painful the bladder is. Then, urinalysis. It will show pH, presence of blood, protein, crystals. One of the most important indicators is urine-specific gravity. The goal of treatment is to make the urine less concentrated. Ultrasound is the vet's eyes. It reveals the bladder walls, clots, stones that aren't visible on X-rays. X-rays detect dense radiopaque uroliths that might be missed on ultrasound. Ultrasound and X-rays aren't competitors, they're partners. Often, both methods are needed for the complete picture. Don't skimp on diagnostics. It's the foundation of proper treatment. So, the diagnosis is made. What's next? Give me a universal medicine for FLUTD. There's no magic pill. Treatment strategy always depends on the underlying cause. For urethral obstruction, emergency protocol, pain relief, catheter placement, under anesthesia, fluid therapy to combat dehydration, and electrolyte imbalances. For idiopathic cystitis, pain relief, increased water intake, and environmental modification. NSAIDs and glucocorticoids are usually not used. For struvita, diet to dissolve the stones. For oxalate, stone removal. For infection, antibiotics based on culture results. Treatment is always individual. Follow your veterinarian's recommendations and don't try to treat like your neighbor did. But the best battle is one that never happens. Let's talk about prevention. My cat is healthy. Why change anything? FLUTD prevention stands on 3 pillars: water, nutrition, and environment. Water. Cats are naturally low water intake animals. Your job is to outsmart nature. Place several water bowls around the house, buy a water fountain, switch to wet food, or add water to dry kibble. The goal is to dilute the urine, which will be reflected in low specific gravity values in lab tests. Nutrition. Feed quality diets. If there's a predisposition to stones, the vet will select a special preventive diet. Monitor weight, encourage activity. Environment. The N+1 rule for litter boxes, where N is the number of cats. So if you have 1 cat, you need at least 2 litter boxes. They should be clean and conveniently located. Create conditions for play, vertical climbing, and the ability to have privacy. Minimize stress sources. Even if your cat is healthy now, these 3 simple things are your insurance for the future. So we've covered the entire FLUTD umbrella. This isn't one disease, but a whole complex of problems where everything is interconnected. Stress triggers cystitis. Excess weight increases risks. Lack of water leads to stones. The main thing you need to remember: your attentiveness is your pet's main lifeline. Any deviation from normal isn't a reason to wait, but a direct signal to visit the vet. And now, a question for you. Have you dealt with urinary tract problems in your cat? How did you handle it? Write in the comments. Your experience could help other owners. Hit the like button if this video was helpful and subscribe to the channel. In the next episode, I'll tell you how to properly set up a drinking routine for a cat that categorically refuses to drink water. See you next time.